Today's medical-centric topic is vaccine fatigue, psychological drivers. Why vaccine fatigue is emerging. Vaccine fatigue refers to declining motivation to receive recommended vaccines after prolonged or repeated vaccination campaigns. Instead, it is a psychological response to sustained health demands, uncertainty, and emotional overload. Not the same as vaccine hesitancy. Vaccine hesitancy involves doubt or distrust about vaccines themselves. Vaccine fatigue occurs even among people who believe vaccines are effective and safe. The issue is not belief, it is mental and emotional exhaustion. Cognitive overload and decision fatigue. Repeated public health messaging, changing guidelines, boosters, and evolving recommendations create decision fatigue. When people are asked to make frequent health decisions under uncertainty, motivation naturally declines, even when decisions are beneficial. Risk perception shifts over time. As outbreaks fade from daily visibility, perceived threat decreases. Humans are wired to respond strongly to immediate danger, not long-term prevention. When severe disease becomes less visible, the urgency to vaccinate weakens. Emotional burnout after prolonged crisis. Extended periods of health anxiety, restrictions, and social disruption lead to emotional burnout. Vaccines, once seen as relief, may begin to symbolize ongoing crisis rather than resolution, triggering avoidance rather than reassurance. Confusion and inconsistent messaging. Changing recommendations, though evidence-based, can be interpreted as inconsistency. This erodes confidence and increases mental friction. People disengage not because they reject science, but because uncertainty feels draining. Psychological reactance. Perceived pressure or mandates can trigger reactance, a natural resistance to feeling controlled. Even well-intentioned messaging may backfire if individuals feel their autonomy is threatened. Social norm effects. Motivation is influenced by social behavior. When fewer people around us prioritize vaccination, it feels less urgent. Social science can normalize disengagement more than active opposition. Trust fatigue, not just mistrust. Even without distrust, repeated exposure to institutional messaging can reduce emotional responsiveness. Overexposure dulls impact, leading to disengagement rather than opposition. Why fatigue matters for public health. Vaccine fatigue reduces booster uptake, delays routine immunization, and increases vulnerability among high-risk populations. It can undermine long-term disease control even when vaccines remain effective. What helps reduce vaccine fatigue? Clear, consistent communication focused on personal relevance works better than fear-based messaging. Acknowledging fatigue, simplifying schedules, reducing unnecessary doses, and respecting autonomy restore engagement. Trust improves when people feel heard, not pressured. Clinical takeaway. Vaccine fatigue is a predictable psychological response to prolonged health demands, not ignorance or denial. Addressing it requires empathy, clarity, and respect for autonomy. Sustainable vaccination strategies must consider human psychology as much as immunology.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.